a longtime friend and colleague of APT, so I'm absolutely thrilled that he'll be here and that all of you will have a chance to get to know him and his work. And to start with, we'll do introductions, but for those of you who haven't been on the webinar before, if you have any questions that come up regarding the topic that we're discussing today, which is defense restructuring, all you have to do is write a question for us on the panel, and it should show up so that we can see your questions. And periodically throughout this webinar, Maneet and I will look to see what questions people have shared with us, and we'll discuss them together. But for now, let's just begin with introductions. And Maneet, thanks so much for joining us today. And I'm just hoping that maybe you can tell everyone a little bit about yourself so we can get to know you and your work.
Yeah, no, thank you so much, Kristin, for having me. I'm very grateful for the opportunity and looking forward to this next hour, the hour of power, as we'll call it. No, I'm a licensed clinical psychologist. I had the honor and privilege of working with Lee McCullough, starting back in 2006 when I was a graduate student at McGill, studying psychotherapy process research. And I came across her book, Affect Phobia Therapy, from a colleague who had gone to one of her trainings in Boston. And he's like, you have to read this book. It's going to be amazing. It's going to change your life. I'm like, okay, no problem. So we read it, and in true Lee form, I became very interested in her work, and I wanted to do research. And she was very giving and open to helping younger students learn. And you know, she didn't have an ego about those kind of things. So she was very open to me, and we started doing research together. And then I got the privilege to get to know Kristin. You know, I think it was 08 or 09 we started to get doing research together.
Yeah, 08, I think.
Yeah, 08, yep. And we published a couple of articles and some book chapters, and you know, we've been in constant contact over the years, you know, working together, you know, kind of as colleagues, and she's been like a mentor to me as well. So thank you for having me today. And in terms of my practice, I do work from an APT perspective as a psychologist in private practice, so this is very dear and near to me.
Great, great. Well, I just can't believe that we're finally doing webinars for APT, and that you're one of my first guests. And so I'm just delighted that we'll be able to be talking about defense restructuring together and sharing with everyone a little bit of what we've learned from Lee over the years.
Yeah, me too.
Yeah, yeah. So, you know, to begin with, we do have a PowerPoint that we're going to be looking at, but we're basically going to use it mostly to just help guide us through this discussion. I think it's most important that we try to like share with everyone as much as we know without leading too much into the PowerPoint. But to begin with, it's good for everyone to be aware of our upcoming workshops, because we have some very exciting ones that are happening. And the first one is on transgenerational affect phobia that is going to be taking place in Stavanger, Norway. And it'll be the first time in 7 years that APT has come back to Norway since Lee left in 2010. And then we'll be having an advanced training in London, and this is like open to anyone who is interested in watching videos of psychotherapy sessions or bringing in their own videos of psychotherapy sessions in order to like receive feedback and for us to do coding. We'll be bringing out the ATOS scale and trying to help clinicians see if they're helping their clients be able to face their defenses, regulate their anxiety, and experience emotion. And then we'll be having our new workshop, When Therapy Stalls, in Stockholm, and then another advanced training opportunity in June in London. And so I'm hoping that people will be able to come out and see some of the work that we do. But to start with Maneet, usually I kind of come up with like guiding questions just so people can like track what they're learning during our webinar. And so some of the guiding questions today is, you know, is a person, is a clinician able to create like a compassionate therapist stance?
Mm-hmm.
And I know that's something that you and I have talked a lot about in the past, and so I think that we might be able to offer them some really good feedback on that.
Absolutely. Yeah.
Yeah, yeah. And then other things are, you know, how do you help your clients become aware of their defenses? How do you regulate anxiety? How do you point out strengths related to a defense? Explore cost and benefits, work with grief, and then ultimately motivate your clients to give up defenses. And so, you know, my hope is that we'll be able to cover all of that for people, just so that they can learn through our conversation. And then finally, you know, we hope that all the clinicians watching this will be able to feel more comfortable with collaboration and raising awareness about defenses, regulating anxiety, and then shifting from like defense restructuring to affect restructuring and self-other restructuring as needed. And so we'll look at that. But for those of you who are new to APT, this is the book that Maneet received that introduced him to affect phobia therapy, and it's Treating Affect Phobia, our manual. And that's a really great resource to have if you want to learn the basics of APT. And then the other book that we can recommend is called Changing Character, and this was Lee McCullough's first book, and it's really helpful with being able to learn more in depth about the model, particularly about defense restructuring, as we'll be looking at it today. So we'll start with the review, and so, you know, Maneet, do you remember when was the first time that you were introduced to the triangles?
Yeah, it was when I was reading the affect phobia therapy book, and I'm like, this is an amazing kind of way to encapsulate, you know, how to conceptualize a patient's suffering.
Right.
And I think it's the one thing that I always say that you take with you from this work is just to have this triangle in your mind whenever you're working with a patient, and to kind of go through each point of it. So it's fundamental.
Absolutely. And, you know, I know when I'm working with Nat Kuhn at Harvard with the psychiatry students, and you have also joined us with teaching our class there, and so you know the students that I'm talking about. We always tell the students that if there's one thing that you ought to know, is just the triangles. If you know the triangles, you'll be able to figure the rest out. So
yeah, and it's the idea of like it's the what, how, and the why of people suffering, right? So I think today we're focusing on the what, the defense,
right,
or that rather, yeah, the how rather, yep, you know.
Right, absolutely. And so, you know, it starts with the triangle of conflict, and so as Maneet said, we're going to be focusing in on the defenses. Yep. And just like, how do you help clients become more aware of the defenses, to understand like how their defenses are affecting them, to explore whether or not they want that to happen, and if they're interested in making some change, and letting go of their defenses so that they can access affect. So, you know, Maneet, when you were talking about how this kind of captures, the triangles captures psychotherapy and how to like end people's suffering, the important triangle to pay attention to is the triangle of person, because, you know, in APT, you know, we really believe that people learn affect phobias, and that in order to resolve an affect phobia, they can unlearn that affect phobia, but we usually have to go back to the past to explore like what trauma occurred or what behavioral training they received, in order to know like where we need to undo the phobic reaction.
Yeah, absolutely. I mean, we look at, you know, even in the first few moments of therapy, when you're sitting with the patient and noticing how they're interacting with you as a therapist, your mind goes to, okay, so this is likely from the past or current figures, and we need to as we start to evaluate them, understand how this came to be. But you'll notice right away in session there are nonverbal cues. You know, talking about their feelings as opposed to being able to feel the feelings. But, you know, avoiding eye contact or jitteriness, or maybe sitting a certain way. So all of these are important cues as therapists say, okay, there's some defensive behavior going on here, and it didn't just happen today with me.
Right.
So it started somewhere else, and to track that in your mind about the dynamic of the triangle of conflict with the defense pole and then the triangle of persons, and starting to make your own notes and observations about, okay, this is going to be part of their script and their learned behavior over many years, and we're going to have to start to unpack this together.
Yeah, totally. I mean, you did such a great job of like summarizing what it's like to be in front of a person and getting to know them for the first time, and how like our minds are just literally soaking in every single detail that we can to basically decipher, is this person connected to their emotions and their self? Are they connected to me?
Yep.
Or are they disconnected in any way?
Correct. Yep. Absolutely. And the idea is that, you know, therapy doesn't happen in a vacuum. It's like, it's parallel processing, right? So they're going to react to us as they would with other people. So that's the first step right there, to understand those relationships and those defensive behaviors.
Right, definitely. And if we look at the triangle of person, like we could see this like with the therapist on the bottom of the triangle. I mean, basically, you know, we're paying attention to like what's happening in the moment in session, and we're trying to get a sense of like if there's a phobia, like where did it come from? You know, who in the past helped this phobia be developed? But as we're listening to a person talk about what's happening in their current life, we're also thinking about how is this phobia playing out with other people in their life, and who is it playing out with?
Right.
And then for us in session, how is the phobia playing out in session with us? And you know, you know this, like if we see a phobia coming out with us in session, then we can kind of automatically guess that it's related to the past and a past figure,
yes.
Right? And that it's most likely playing in their present life too.
Correct. Yep.
Yeah, so it's sort of like when it happens with you, you could just be like, okay, who's the past person, who's the present person? I
just literally came out of session where I was talking to a patient about, you know, their tendency to kind of laugh off their sadness, you know, or their emotions, and I said, you know, this didn't happen randomly.
Right.
You know, the way you're responding to this feeling in session with me is not random. And you know, going back to the first point of our lecture today about the therapeutic stance, you know, you don't say it in a judgmental way or a negative way. You just say compassionately, you know, I noticed this kind of tendency, and I wonder where it came from or how it came to be.
Right.
So yeah.
Like maintaining that like curiosity and openness, and you know, it's interesting because like when we're working closely with emotion, a lot of times what I feel like I'm doing is I'm just welcoming emotion. Like whatever emotion is there, I'm just welcoming it, accepting it.
Yeah.
Right? But the same thing goes with understanding a person's triangles. You know, just being curious and asking where did you learn that from, or who has this played out with. And if you can stay really curious and open, it's amazing how many stories will begin to unfold. And with all those stories come all these details, and suddenly the, you know, a question of where did the phobia originate from, you know, the answer arrives in the details.
Yes.
And so it's so beautiful, the work that we do, that, you know, simply by being curious and compassionate and open, you know, people are just really drawn to opening up and sharing what's gone on in their life.
Absolutely.
So, yeah. So you know, here we go. We're already talking about this on the slide, and it's, you know, when you're trying to find out the origin of a phobia and how it's maintained, You know, it's always helpful to wonder, like, how old was my client when this phobia was activated?
Yeah.
And who was it activated with? And who reinforced it, and who is reinforcing it today? And, you know, I know when we begin treatment and people begin to let go of their defenses and start moving to affect exposures, you know, the relationships outside of our sessions begin to transform and change. And sometimes it's easier for the change to happen with present figures. You know, but going back to the past figures, like what happened when you were 4 or 5 with your mother and father, that could be so much more difficult.
Absolutely. And one thing, and one thing you'll hear too a lot is they'll say, well, and this is kind of a rationalization or an intellectualization. Well, I can't go back, so what's the point? Right? And when I was young, you know, I'm not 7 anymore, I'm not 8 years old, my father and my mother might even have passed on, for example.
Right.
So why do I have to talk about this now? And I think that's a classic and important defense that, you know, patients bring up. So in that example, you know, Kristin, how would you respond in that situation? Would you just reinforce the, you know, not to put you on the spot, but
right. Well, I hear that at least once a week.
Yeah.
You know, and sometimes even with people who I've been working with for a while and they've already done a lot of good work, it's like it's like that defense just kind of comes up so quickly and easily.
Yes.
And you know, I mean, I think one thing that's true about affect phobia therapy is we're really trying to get at the core of an issue. We're not trying to like have like a superficial like change. We're trying to get at the root of the problem and be able to work with that, and so that someone can experience long-lasting change.
Yeah, and I think part of the challenge is as therapists too is that patients will make the idea of what do I do with it is also kind of a defense. It's the idea of like part of our job is to, the whole idea is to non-judgmentally, compassionately, and just genuinely experience the feeling. So the piece here is as therapists to impart that on our patients and even on ourselves to not feel like our own anxieties is that part of our journey is just allowing them to feel.
Right.
Like literally just be able to feel the emotion.
Right.
And the rest of it we can deal with after. But getting to that acceptance that I can even allow myself permission to feel this and not have to do something with it per se. I think we get caught up in the doing of it, right? And I think that's where people get stuck.
Absolutely. And so like when someone's saying, you know, why do I have to do that? Why do I have to go back to the past?
Right.
You know, a lot of times I'll say, you know, simply by us exploring the past and what happened is going to activate emotions inside of you that typically you repress and you push away. But because we're working together and we're helping you increase your awareness of what's happening inside of you, then we can pay attention and actually help you be able to experience those feelings versus just pushing them away like you have for years or decades in some cases.
Yep, and I think we'll probably get to this later in the slide, but it's the idea of like, you know, part of the reason why they don't want to go there is because of the affect phobia that's activated and the judgment or the criticism that comes with a certain feeling. So I avoid it because when I did experience it, or in whatever form it was negatively viewed, I was criticized, it wasn't handled. So it's better for me to avoid it. You know, at least I think that, right? And that's the idea of the costs and benefits and of defenses.
Right. And what's so fascinating is sometimes, you know, when people have projections, right, they'll project onto you as the therapist or onto their friends and people who are in their life and assume that there's going to be judgment.
Yes.
That's not necessarily the case.
Absolutely.
And that so comes from the past. They had a bad experience when they were younger. They grow up and imagine that that's just going to continue. And so we have this like really incredible opportunity in session for someone to have a different experience, you know, for their emotions to be accepted versus shamed or attacked. And I mean, I know you've probably seen this in your office, but it's such an incredible moment when someone takes a risk and they're willing to experience a feeling that they usually repress, or to talk about a defense that they've never looked at before, and then they discover, like, it's okay.
Yeah. Yeah.
I survived. Nothing terrible happened.
Well, it's the idea of the anticipation and the build-up and all of this pent-up. We always say this in different language, but the amount of energy and the amount of, really emotional turmoil you put yourself in and exert to avoid a feeling is usually a lot less than the amount of energy and emotional investment in feeling the feeling.
Right.
So, and that goes back to the costs and benefits, right? That, it's like, I was rock climbing on the weekend for the first time, and I was on the anchor, and I had to just let go and just jump off the wall, so to speak. And the buildup was causing me all this anxiety. Oh my God, what's going to happen? And then you do it, you're like, hey, it's not that bad actually. I survived, right? So the same thing happens with defenses. It's like building up the rationale, the motivation in our clients to say, you're here because you want this to go. But a part of you doesn't want to change because you don't know how, or don't feel you have permission or have the tools. Right. But if you allow yourself permission in here to try it, the result won't be as bad as you might think in your head. And that goes back to the anxiety regulation piece we do with defense restructuring and relinquishing.
Right. Because always, when you're looking at someone's defenses and you're pointing them out and helping them become more aware, the anxiety rises.
Yes.
And it can just be so uncomfortable for a person to just be looking at their defenses, especially for the first time.
Yes.
And so, we always have to be ready. Like if we're going to be pointing out a defense, increasing someone's, or helping a person increase their awareness of a defense, we also have to be ready to shift into anxiety regulation.
Yes.
And to work with the shame that might come up, or the guilt, and so that's where APT is so interactive, because I could be maybe more comfortably in my seat, feeling some of my own internal anxiety with pointing out a defense to someone, right? And so I always notice when that happens. I'm sure you do too. That oh, do I really have to say this out loud?
Absolutely.
But it's my job.
Yeah. Exactly. I think we talk about later as well the idea of who it's kind of counterindicated with in terms of their own ability of function level, and you learn that if I had a situation last week where I'm working with a person who has borderline personality, and trying his best. He's he's trying to function, and we did doing some gentle defense work, but you could tell it was gutting him. Like he was feeling visibly anxious in session, and he was sitting over like this, and he's like, this is heavy. Right. And because that's the idea of the shame and the self-attack. So at that point you have to say, okay, Maneet, slow down. Right. Even though you're not intending to be critical, he's not having the capacity right now to hear all of this, or making sure you go back and really reframe with the patient. Okay, what did you hear when I talked to you about these defenses? What are you taking from this? Right? Maybe you're hearing something different than what I'm trying to say.
Yeah.
And maybe he's hearing some criticism. Maybe I'm playing that past figure right now, even though I'm not intending to, the projection, right? So it's the ability, and that's why the triangles are important, because it lets you move back and around. Say, okay, maybe I went too far on this one, and now this is being activated. Let's go here. And it's that moment-to-moment, flexibility. I think that we have to be extremely conscious of and aware of, and not get too caught up in tunnel vision, like I have to do this now no matter what. It's therapist flexibility and being able to move around in the triangles.
Absolutely. And I think that is probably one of the most important skills that we learn as APT therapists, is how to be flexible.
Right.
How to be able to be focusing on defenses and then begin to shift to anxiety regulation, but then also knowing when can you go back to the defense work.
Yes.
And then, you know, when there's an opening, let's say you're helping someone recognize their defenses, you're helping them increase motivation to begin to let go of their defenses.
Yeah.
You know, next thing you know, you could be with an affect exposure, and so you have to get ready to be able to shift to an affect exposure.
Absolutely.
And no matter where you are on the triangle, it takes a different skill set. Like if you're working with defenses, you're working with anxiety, you're working with affect exposure.
Yeah.
And so like our ability to be flexible, but that requires to also assess in the moment, well,
Yes.
where is the client on the triangle?
Exactly.
Right? Like the triangle helps guide us with our treatment, but we have to be able to assess where they are. And then we have to be able to, as you said, be flexible and work from each corner of the triangle.
Absolutely.
And, you know, the joy is that once we learn the basics, it really does become, I can't say fun necessarily, but it becomes delightful, you know, when like working the triangles happens and you're working on the defense pole, anxiety pole, feeling pole, going back to the triangle person, you know, so it can be a really enjoyable experience.
Well, I think I think part of the enjoyment part is the idea of sense of, I mean, for me, maybe this is your experience too, is that, you know, as a therapist, you know, I'm guilty, as we all are, of sometimes feeling lost in session. And I think we take on, we're holding a lot of information, you know, both trying to conceptualize and also trying to be with our client and hear what they're saying, both from a content and process level. But I think over the years, what's really helped keep me grounded is the triangles.
Right.
It's like knowing what you don't know and knowing what you need to know. And I think that's what you're getting at, is that it can become empowering when we as therapists kind of know where we're at in the poles.
Right.
So we don't get stuck or feel overwhelmed as well. It will be anxiety provoking for us, and we will feel overwhelmed by the emotions and the stories we hear, but it's also knowing that while we do that, simultaneously we're holding these triangles and we know where we have to get back to or where to be. So that's empowering, right, for us.
Yeah, definitely. And without a doubt, every single day that I'm working, there's moments where I'm not quite sure what to do, right? So
Yeah.
all I ask myself is, well, where is my client on the triangle?
Yeah.
And if I can ask that question and say, well, it looks like the defense pole, it looks like the anxiety pole, it looks like the feeling pole, then I'm able to, it's like I have a roadmap of what to do next.
Yeah, absolutely.
So it's, you know, because sometimes it can be very confusing, especially if someone's very resistant or has a lot of trauma that's intermingled with the affect phobia, and perhaps like they're very close to some memories coming up.
Yes.
Suddenly it can get confusing, and so just being able to say, well, where are they on the triangle, and to work from that place really helps things stay clear. Absolutely. And you know, I had one person really teach me a lot about defenses, and one thing that I learned was that this particular person saw their defense as really like their friend, as their protector, right? And it so happened they were having a very difficult time accessing anger and rage, and meaning it felt like it was almost impossible. But the minute we were able to identify that their defenses were actually protecting them from a trauma memory, then we were able to kind of slow down and work with the defenses in a very slow, you know, caring, loving way until the person felt safe enough to begin to access the anger and rage.
Yeah.
And so, you know, that piece about really listening, being curious, collaborating with your client is a huge one, because you know, that collaboration a lot of times opens the doors to be able to access the feeling. So I'm just gonna pop over to the PowerPoint real quick, but I'm not gonna stick with the therapist dance because I think we've done a lot of that so far. Mm-hmm. But I'm thinking that we probably need to help people just really get the basics of defense recognition.
Absolutely.
because that's such a cornerstone piece. And then we'll look at defense relinquishing.
Yes.
So anyway, with defense recognition, what I find so delightful is that really when we're going to be pointing out a defense to someone, we're always working with a specific example. And
Right.
so it might be that somebody in the moment, like the client that you had today,
Yes.
was laughing in the face of sadness.
Yes.
So I'm going to ask you, did you today say, okay,
Yes.
what did you say?
Yeah, I mean, it has different variations. I think it's an important part is also depending where you are in the therapeutic process with your client. So in the beginning, it's gently pointing out to them, I notice when you talk about something that causes you sadness, you're laughing, right? So it's pointing out the defense mechanism, which is the laughter, in the face of the feeling, which is sadness,
Right.
And I think that's, so you gently point it out, and as you get along with more therapy with them, it's, part of it is when they start to understand that this is part of the defensive structure, it's even noticing that in our relationship it plays out too, that you'll laugh or brush off this feeling of sadness. So first thing is just to identify it and to put
Right.
it out there for the client, and usually they go, yeah, they might say, oh, I didn't notice that I was doing that, or they might say, yeah, I do this often.
Right.
In my life, I notice that I do this often, where I laugh when I feel an emotion.
Right. Right.
Mm-hmm.
And I always remember Lee telling me that when you point out a defense to someone, they actually feel seen.
Yes.
Even if there's a lot of resistance and they're really avoiding it, it's almost like you go straight inside a person and let them know, like, you're really noticing them, like you're really seeing them. Yeah.
I mean, I've worked with patients who, have gone to other therapy and they come in and they say, like, you get me,
Right.
It's like, okay, you really understand, like, you're seeing beyond just what I'm saying, like, you're with me at a deeper level, and that's exactly the feeling, and I think that's an excellent point.
Yeah, and and I've heard that a lot too, and sometimes people even say, like, it feels like you're inside of me and you can see what's really happening.
Yeah.
And that's really all about good defense work. It's about noticing when someone might be laughing when they're really feeling sad, and then being able to have the courage to say it out loud.
Yes.
And and so it's a tremendous gift in a lot of ways.
Yeah.
So I'm just going to have us move up to defense relinquishing for a moment, and let's see if I can get it. And let's look at the steps for defense relinquishing, because defense recognition, I mean, really, if we're just paying attention to the importance of helping our clients increase their awareness of their defenses, right? And we do it in a compassionate way, and we time our interventions so that it really sinks in with our client, and we're able to do the anxiety regulation. Mm-hmm. It's really just something that you need to practice doing over and over and over again.
Yes.
And and this is one reason why I'm always encouraging people to start peer supervision groups. Yes. Or research groups, so that they have someone that they can practice with, and just do that role playing. But defense relinquishing is, there's a lot more aspects to it, and like learning how to point out cost and benefits, learning how to, like, demonstrate concern for the defense, helping someone understand, like, their primary and secondary gains, and then also working with the grief that comes up, and moving toward the affect exposure. And so, you always strike me as someone who's probably very good with motivation because of all your, background in athletics. And so I would love to hear more about, like, when your clients can recognize their defenses, like, how do you help them gain the courage and the energy to maybe even let go of them so that they can experience an affect?
Yeah, no, I think it's it's everything you're talking about in these are all really good bullet points. I'm just looking them over, and they're really, I think the first thing is, I think as therapists, it's, if you do it in a way that's curious and with care and compassion, you can push the envelope a little bit, right? And it's like, and I will say, it says here, dramatize what is at stake, and you can say, like, it must be really tiring being you. Yeah. If you have to constantly say yes to everybody and you can't say no, right. And it's talking about how tiring it is and how exhausting, how thankless it is, for example, right? And and the cost of being burnt out, not being able to have a life outside of these kind of obligations. So you really challenge them to kind of face that. And there's also those clients who, we talked about this last week, some clients who might activate your own kind of like frustrations, like, come on, like, let go of this anxiety, this defense, I had a client who said to me, well, I know every few months I'm going to feel upset, so what's the point of therapy, and I'll drink a lot and smoke some cigarettes or other kind of drugs, and I'll just kind of go along with my life. And I'm like, well, that's pretty expensive. It's going to cost you a lot of money to keep drinking and engaging in smoking marijuana all day. You can choose to do that, or you can choose to kind of take the step here with me, that the healthy part of your mind that wants to kind of get beyond this because you're here. Right. And to face this with me in a safe space, because we're not in that unsafe place you used to be, but that's where it began and originated. But right now with me, can you take the courageous step to just kind of step beyond this, because you know how your life is going to be right now if you continue this way. There's no secret about that. But would you not want to take the opportunity to see what could be there for you if you're living without these defenses? Right. And I think it's that kind of negotiation almost with that part of their brain that wants to keep stuck. Right. And I love how, like, as you were describing that, you were just really staying focused on what the client wants. Right. Right. And how it's going to be beneficial to the client. Yes. And I think that's one of the most important aspects of defense relinquishing is always keeping in mind that, first of all, it's the client who needs to be making this change. Yes. And committing to having their life play out in a different way. Yes. Right. And the more that I'm able to remember that I'm helping someone perhaps increase motivation, I have to keep in mind it's motivation for something that they want. Correct. Right, that they desire. Yes. And I do a much better job with defense relinquishing when I'm just aware of the fact that my job is to point some things out to facilitate a process. Yes. So in the end, it's really up to them and what they really want, and if they want to experience change. Absolutely. And when I supervise, colleagues or peers, one of the biggest challenges we face is when we have more motivation than them, or we're motivated to take them to a goal that really they may not have the capacity, the explicit want or need at this time, right? So it's being with them where they're at right now, and it's encouraging them to be courageous about what they want to change in this moment, and pointing out that kind of conflict and battle. Right. Right. I don't want to change, but I'm sitting here, so I want to change. Yeah. Yeah. Right? And how do I do it? Yeah. And for a lot of the people that I meet with, they had a childhood traumas where their ability to assert themselves was really shut down. Yes. And so the defenses that they have on some level equals like dependency on others. Yeah. Right. And so, a lot of times when someone like that is beginning to kind of face their defenses and ready to relinquish them, they're also stepping up to the plate and doing something for themselves that's going to be really beneficial to their lives. Yes. And is going to help them feel so empowered and strong. Absolutely.
Yeah, and so it can turn out to be one of the most kind of beautiful moments. I know we always focus on the affect exposure,
Right.
but that moment when someone's turning against their defenses and ready to take a step toward an affect exposure, it's just beautiful because it's hard for them to get to that place. But when that shift does happen,
Yeah.
you know, it's always a moment of celebration, right? It's like, yes,
Absolutely.
you
And when
did.
they, yeah, and when they can even do it in small doses, they feel good, they feel empowered. And I think part of defense relinquishing, one of the ways you asked the question about motivation, I think one of the important things is helping our patients. We talk about the origin of the defense, and I
Yeah,
think it's important that they understand that, you know, it makes sense if I'm making up the name, Johnny. It makes sense if you didn't, you avoided your feelings because you grew up in a house where if you expressed your anger, you were abused.
right,
So it makes sense. It was for your safety to avoid it. That would
right,
make sense. That's adaptive in a maladaptive environment.
yeah,
So we don't judge you for that, and we understand. But here you are today, and you're not in that environment. And
right,
that I always give the analogy of like defenses being like milk that'll expire at some point, right? Like the idea is this defense is no longer needed.
right,
You're living in your own house. You're an autonomous individual. You're not in that environment. So that defense kind of doesn't really fit in today's where you're at. So one, it's the grief and the acknowledgement and the compassion for what you went through, and then why the defense needs to be there and why it's maintained. But then, like you talked about, Kristin, the sense of like, okay, that means I don't have to be this way, and when I act differently, it's going to feel empowering. I'm going to feel stronger in my body.
yeah, yeah. And you know what's fascinating is when you're working between the defense relinquishing and the affect exposure. And I'm thinking about us as therapists. You know, again, we have to be really flexible, as you were mentioning,
Yes.
because it's sort of like, you know, we have to be willing to let go of the defense relinquishing process
Yes.
when the affect exposure takes place.
Yes.
And so it could be the hardest thing, though, because, you know, let's say you're focusing on defenses for like 20 minutes, and it's just that narrow-minded kind of focus on defenses, and then all of a sudden the shift happens, and it can happen so quickly. Then
Yes.
all of a sudden you have to kind of take a step back and start being open to an affect exposure, and which is a whole different way of working. You know?
Absolutely.
Yeah.
Yeah. Like on the
Yeah.
fly, like, oh, I was going to make that comment about the cost again, but then you just dived into your feelings, so let's go with it. Let's be there.
Right.
And
Right.
sometimes I'm like, hey, I gotta say to myself, Maneet, you gotta shut up right now. Let them feel the emotion coming up, right? Because don't get caught up in your theory now. Let them, you just be with them, you know?
Totally, totally. Yeah, there's been so many times where I'm saying to myself, let it go, let it go, let it go, right? But sometimes, like, my body's just in this pattern of working with defenses. It's very, very difficult to pull back. So,
And I think part of it also, I think we talked about it maybe in other slides too, is the idea of not being afraid to be even repetitive when you're doing
right,
the relationship, like constantly going back there, and not to think that you're being a hound or you're being mean. It's just that because they're going to want to escape it, right? So just saying, okay, you know, going back and keeping it a focus and making, you know, and staying with it and being vigilant in that process while you're in that space.
right, right. And you know, another thing is I think with APT, like when we're training therapists to use APT, we really do stay away from following the formula, like having a formula for the therapist to follow. I mean, of course, there's like defense recognition, there's defense relinquishing, there's anxiety regulation, but we really help therapists have enough elbow room that they can kind of do it in a way that's really in sync with their clients.
Yes.
And so, you know, on some levels that can be frustrating as you're learning APT, because it would be so much easier to just have a roadmap of like, this is the right way to do it. But because we have to be so flexible and creative at times, you know, with training, you know, we have to kind of help our therapists, you know, be able to practice flexibility and creativity. So.
Absolutely, yeah.
So I'm just noticing the time, and I'm assuming that some questions have come through, and so we should probably take a moment and just look at those questions before we wrap up. Are you ready to do that?
Sure.
Okay, all right. So hopefully some came through, and okay, we have, yes, they did. So one of the questions is, please give an example of distinguishing between primary and secondary gain.
Mm-hmm.
And that's a great question. So you know, that's something. It's probably been one of the things that I've been most obsessed about, because I know when therapy stalls a lot of times, for me, it means that there's a secondary gain that's at play.
Absolutely.
Somebody's getting something, this hidden jewel, right, from the secondary gain, but we just haven't talked about it yet and brought it into the session.
Yep.
And so a lot of times, like, if I feel like, gosh, I'm doing good defense work, but change isn't happening here, then I start thinking, is there a secondary gain? And I start exploring what that could be. Yeah, the
idea of sometimes, you know, I get the example, you know, it varies from patient to patient and it's nuanced in its own way, but sometimes the idea of, for example, if, you know, if I stay stuck, the primary gain is, you know, not having to face, you know, let's say avoiding a feeling or not asserting yourself, so I don't have to avoid the anxiety and the fear of being rejected or being judged and all that anxiety, but so the primary gain is avoiding this fear of being rejected or you know, vilified. But the secondary gain is, in some contexts, is I can stay stuck, which means that I can still be the victim.
Right.
And the only way I get, when I say victim, I'm very sensitive. What I mean by that is the only way that I got attention might have been by being upset or being hurt. Right. So I'm only taken seriously if I'm ill or if I stay stuck, you know, and I think that's part of the secondary gain. The primary gain is, you know, I want to, you know, I don't want to, I'd rather not be assertive because I'm afraid of my feeling of anger or sadness or whatever. And the other side is staying stuck gives me reinforcement. I get taken care of, you know, or I get validation in some sort of way.
Right, absolutely. And you know, I think, again, this is where creativity and flexibility comes in, because sometimes you have to really think outside the box in order to understand what the secondary gain is.
Absolutely.
And it can be hard to approach that. I mean, it's hard to look at someone who is trying hard in therapy and be talking about how perhaps their secondary gain is they're playing the victim in their life.
Yep. Yeah.
And not an easy conversation to have, especially when they're highly motivated.
Yeah.
But one of the things that I've noticed is that when a client and I do talk about secondary gains, that's frequently when things start changing, because it's like we get it out into the open and work with it, and then they're ready to move on to the affect exposures.
Absolutely.
Okay, so I'm going to look at another question here. So someone, this is a great question. What is some of the language you would use for helping someone shift from ego-syntonic defense to a more ego-dystonic defense? And I know in the last webinar that was very confusing. Because when we're talking about defenses, we want people to be able to be in conflict with their defense on some level. Like, to challenge it, to want to turn against it.
Right.
So yeah, can you think of how you might approach that with a client, just helping them see how their defense isn't working for them? Yeah. I
mean, the good thing is, I mean, a defense is working well if it's ego-syntonic by definition, right? That's the point, right? It's the idea of, like, if it's ego-syntonic, that means A, I'm not aware of the defense, or B, right, I'm still not ready to let it go. So it goes back to what we talked about earlier, and I think it's important when me and Kristin talk, we kind of free flow, but if you want to use certain, like, you know, the idea of clearly, continuously naming the defense, continuously letting them know that this idea of when you avoid eye contact with me, or you laugh when talking about sadness, or you rationalize, I will use that language. So right now, John, you're rationalizing this emotion, or you're, avoiding, you're avoiding eye contact, because maybe this is difficult for you. So the more, and that's why it's important to be repetitive, because what you're doing is you're constantly making your patient aware. And by definition, when you make them aware of the defense, that's when the conflict comes to reality, and that's what you want. And then it becomes more and more, there's more of a conflict within them, and it's not just an automatic process. So the language, you use is really the idea of continuously challenging the defense and continuously pointing it out and getting them to see this is not just the way it has to be, if that makes sense, right?
Right. And, I'm glad that you mentioned that, using the terms that we use for defenses, because I do find it much more helpful in session if I'm sharing those terms with my clients.
Yes.
So that they can see, well, this is intellectualization, this is rationalization.
Yes.
This is avoidance. It's almost like we get to share a common language.
Correct.
And, I know when I was just beginning, I was a little bit shy about using those words because they seem so pathological in a way, But I found over time that it really helps someone kind of harness in on, okay, this doesn't always work for me, and I don't necessarily always want to be doing it.
Right. Yeah.
And yeah, the repetitiveness is very, very key.
Yes.
So, okay, let's try one more question here, and then we're going to have to begin to wrap up. But this question is about our PowerPoints, and yes, I can share our PowerPoints. so just go ahead and email me, and I'll get you a PowerPoint. Okay. So someone is interested in speaking about the differences between APT and AEDP, and actually, Maneet, what I'm thinking is, why don't we do a webinar with an AEDP clinician?
You should. That's definitely a good idea.
I know a few of them, and I'll see if I can make that happen, because that would be really fascinating for us to do. There's not enough time right now to kind of look at the differences. But we'll try and get a webinar together so that we can look at those. And okay, okay, some of these questions at this point, because of the time, I can't really get into them. But there is one question that we could look at real quick, and it's how do you expose your client to their anger and rage? And I'm only saying, let's look at that real quick, because we are heading toward an affect exposure webinar coming up soon.
Yes.
And so I would just say to the person who asked that question, come back for the affect exposure webinar. But one thing to keep in mind is that when we are helping our clients relinquish defenses and move toward affect, it's an organic process.
Yeah.
We're really, as Maneet was talking about paying attention to nonverbals, we're really looking for nonverbals. So if somebody has like their fist up and raised as they're talking about their father, it's usually a good indicator that you'll be working with some anger. So a really easy thing to say is just say, do you notice that your fists are raised right now? And what are you feeling in your body, right?
Yeah.
And wait for the words that the person shares with you.
Yeah,
So,
I mean, that goes into almost like affect exposure and experiencing, but then even that, you can even do acknowledgement of the defense, where you're saying, you're talking about your dad and you're smiling, but you got a fist.
right.
So there's a defense operating there because there's an inconsistency between what you're saying and what your body wants to do or what the feeling is. But that goes to Kristin's point. Like, one thing I would encourage is, as you're training in this, it's to understand each thing as being its own topic and own area, but in session, once it becomes second nature, like riding a bike. You kind of go from different things back and forth, so one can lead into the next, and it's the idea of that flexibility, as you talked about, Kristin.
Right. And one thing that all of us can lean into is your job is to increase awareness, right? Yeah. And also to help people be able to articulate what does something feel inside of them, and that's a form of increasing awareness. And if you do that, things are just going to flow naturally.
Yep.
So,
yeah, so, I would, yeah, go ahead.
Yeah.
No, I was saying that the key thing for me with defense is helping patients be aware that they're there, and to be repeating that and continuously staying on them for that in a generous and gentle way, and to also help them understand that there's costs and that they can get past this. I mean, and if you continuously name it, eventually they'll say, "Oh yeah, here I go again, Maneet. I'm laughing it off."
Right.
I'm right. Defenses now, and they'll catch on. And then you start, okay, let's work through it. Let's get past it. Let's kind of push forward. So, for me, when it comes to defense recognition and relinquishing, is actively being involved, continuously naming it, understanding the origin and the maintenance, and helping them see that their life could be better if they had the courage to face this with us in session.
Great, absolutely, absolutely. And I'm really glad that you pointed out when people start noticing on their own, because that's usually the defining moment of moving to relinquishing, is when they're noticing, well, this is what I'm doing, right?
Absolutely.
So, okay, well, Maneet, I just want to say thank you so much for joining us today, and I look forward to having you join us in the future. So,
look forward to it, and thanks to everybody else, and I hope you all enjoyed this. Thank you.
Thank you. Bye-bye.